Hi, for those of you watching today, my clinical assignment presentation is on cannabis use disorder. Cannabis use disorder is just one of a couple of cannabis-related disorders within the DSM-5. There is also cannabis intoxication, cannabis withdrawal, other cannabis-induced disorders, and finally unspecified cannabis-related disorders. A general description of what cannabis use disorder is that in the DSM-5, cannabis use disorder is described as a problematic pattern of cannabis use, which can lead to clinically significant impairment or distress in one's life as a result of chronic use of cannabis. In order for someone to be diagnosed with cannabis use disorder, they must meet at least two of the following 11 diagnostic criteria within a 12-month rate. For instance, one of the 11 symptoms of cannabis use disorder is the recurrent use of cannabis resulting in failure to do or perform the essentials from day to day, such as major role obligations either at work, home, or at school. In terms of major symptoms, however, the most common is having a strong urge to use cannabis, which goes on to influence many of the others listed within the DSM-5. Now I'll be providing informative prevalence rates within cannabis use disorder. Cannabis is not only one of the most highly used psychoactive substances, but it also has a very diverse amount of data. I'll be providing three types of data: a 12-month prevalence rate within age, a decrease of cannabis use disorder, and a prevalence rate within race and ethnicity. The first data is children and teens, specifically ages 12 to 17 years old, who reported in at about 3.4%, while ages 18 and older reported in at about 1.8%. And for adult males, men with cannabis use disorder reported in at about 2.2%, while adult females reported in at about 0.8%. This culminates with males and females ages 12 to 17, with males reporting in at about 3.8%, while females reported in with 3.0%. And that's between the ages of 12 to 17. The data for cannabis use decrease was also provided in the DSM-5, which is reported that adults ages 18 to 29 came in at about 4.4% of decrease, while seniors ages 65 and older came in at about 0.01%. Lastly, with race and ethnicity within cannabis use disorder, both categories that grabbed my attention the most was with Native Americans and Alaskan Natives, who both reported in with high rates within both categories, which are ages 12 to 17 and the adult section, with a reported 7.1% within ages 12 to 17 and 3.4% within adults. Now I'll be heading into the differential diagnosis and other mental disorders that are similar to that of cannabis use disorder in terms of symptoms and conditions. And one of them is cannabis-induced disorder, with some symptoms they share are anxiety. Another disorder is that of persistent depressive disorder, which is a mild but a long-term form of depression. This depression is also correlated to cannabis use disorder because of the chronic use of cannabis, which can lead to depression. Dysthymia, which is a lack of motivation similar to persistent depressive disorder, in which both cannabis use disorder and persistent depressive disorder both also share a lack of motivation as a common diagnostic criteria. However, there are ways to distinguish all of these that I just listed throughout so far, and one of them is through a physical examination, specifically a urine toxicological test. Some common treatment approaches for cannabis use disorder is through medications and behavioral treatments. For example, some behavioral treatments are motivational counseling, which is a group of therapy or individual psychotherapy that some explore in order to resolve their ambivalence behavior, in this case, the chronic use of cannabis. For medications, there are specifically anti-anxiety drugs, more specifically one of them with buspirone. Finally, to conclude this presentation, I will now be heading into other pertinent info, specifically comorbidity. Cannabis use disorder and cannabis use are highly comorbid with other substance use disorders, specifically alcohol use disorder and tobacco use disorder. All three of these substances use disorders have ties to poor life satisfactions, increased mental health treatments, hospitalization, anxiety disorders, and many more. With 50% of people with cannabis use disorder also had links to alcohol use disorder, while 53% of people with cannabis use disorder also had links to tobacco use disorder. With as many as 74% of people with cannabis use disorder seeking treatment having also reported of having secondary or even tertiary substances such as alcohol or tobacco. Other substances recorded within the DSM-5 have also been cocaine, methamphetamines, heroin, and other opiates. So in conclusion, this has been a short little presentation about what cannabis use disorder is, and hopefully this was somewhat informative enough for those of you that may have wanted to know a little bit more of what cannabis use disorder is, and hopefully this inspires you to maybe look it up and learn more about it yourselves. So this has been my presentation. Thank you and bye-bye.